All right. Hi, it's Stephanie with the patient story, back again with Clarence, who just got done talking about how you finally got diagnosed with prostate cancer. So thank you, Clarence. By the way, this is a little bit on the side, but I'd asked Clarence, oh, is there a way of making the camera more eye level? And you're like, I'm 6'2", something I don't have to deal with. I'm a whole foot shorter than you. But anyway, so I thought that was funny. So Clarence, going into the treatment portion, which is what we're talking about here, you decided on robotic surgery, and I understand you underwent that surgery in July of 2012. So did you have to prepare for it? Do you remember doing anything ahead of time?
Preparation was more of making sure I had comfortable clothes to wear after the surgery because I was going to come home with got a catheter, and I was concerned about what that was going to be like to have to live with that thing for a couple of weeks, more like 10, 12 days.
Right.
And pretty much that was it. Making sure I had stuff for to bed coverings, just in case there was any discharge or
Right.
or whatever. I just did things to make myself comfortable at home once I
Right.
got home.
So you're just planning ahead for the recovery at home. Did you have to, sometimes with, surgeries, depending on how big they are, they even ask you to take care of paperwork like wills and other things like that. I mean, did that ever come up for you?
I think I did not a will so much as making sure that if I didn't come out of the surgery or if something happened, I did make sure that my paperwork was already in place anyway. But I did sign a DNR just in case someone went haywire or whatever, because that's just who I am.
Yeah. Yeah. But these are things that people don't think about that do come up. I mean, that you do have to think about. Um, any other thing that you think is important for people to know before the surgery happens?
Um, I think you should probably get as much information as you possibly can about things that the doctor's not going to necessarily tell you. I found out some things. I actually experienced some things that the doctor didn't tell me, but because I did the research, I knew what it was and I knew what to do afterwards when it did happen.
And this is things that came up after the surgery?
Correct.
Okay, maybe we'll talk about that then when that comes up. So you get admitted to the hospital. Describe the process of going into surgery from what you remember.
Yeah, they tell you to go the night before. You have to take a shower with antibacterial soap, and the morning of, you have to take a shower with antibacterial soap, and you can't have anything to eat, and you have to be there at the crack of dawn. They laughed at me because they were scheduling surgery, and they came up with a couple of different times. I'm like, well, no, I want to be the very first patient that morning. I want to make sure he's fresh when we're doing this. So, I asked for the earliest appointment as possible. The very first thing is something like 7 in the morning. So that means I had to be at the hospital at 5. But it was just those type of things that we did. Got there, went in and woke up, and I thought everything was great.
Wow. I wish all the stories were like that. So you went in, do you know how long the surgery took about?
I think it was like 5 hours.
5 hours. Yeah, pretty long. And did someone else have to drive you there?
Oh yeah.
Okay, right.
Yeah, I had family that took me, stayed at the hospital until it was over, made sure that I was okay, came in and saw me, after I got admitted to my room. And actually when I woke up and got to the room, I really I thought I felt pretty good. And because actually the doctor had said I'd probably only be there for like a day or two. Unfortunately, that wasn't the case.
And now we get to talk about that fun part, the unexpected longer hospital stay. Yeah, what happened there?
Okay, so following surgery, the doctors, they came in and said, well, drink plenty of fluids. You want to give you water, whatever you want to drink, fine. So I thought I was great. So I was asking for cranberry juice. I was drinking water. I was just chugging juice down. They brought food into me, asked me if I feel like eating. I'm like, sure. And I ate. So my family was still there with me, and probably around 5 o'clock, I said, "Why don't y'all go ahead home? I'm good. Like it's been a long day. Y'all been up since 3 o'clock in the morning, and go ahead home. I'm great. I'll see you all tomorrow." Around midnight, I started feeling bad, and I didn't know why. And I called a nurse. I just felt very uncomfortable, and my stomach seemed to be swelling. And long story short, my stomach didn't wake up when I woke up. So all the juice, all the water, everything that I was drinking was sitting on the top of my stomach. And it wasn't, even though the catheter was in and I had good fluids flowing out, it just wasn't enough, and it made me sick.
Wow.
And the doctors kept coming in, well, what's wrong? So they finally came in. Well, my family came in the next morning and looked at me and said, well, what's wrong with you? And I'm like, I just don't feel good. And well, why didn't you call? I'm like, well, I'm in a hospital. I mean, what am I going to call and say? I'm in the hospital, I don't feel good. So, they called the doctor in and explained to him what was going on. The doctor came in, and so they took me off of nothing by mouth at all for like 24 hours. And after that, I got better.
They wanted you to, so they didn't let you eat or drink for 24 hours. They wanted everything to just flush out, essentially.
Exactly.
But that was the only thing that they could do, was just the stomach had to be awake and
right. They had to wait for it to wake up in order for me to, really do anything. Of course, you have to go to the bathroom before you can leave the hospital anyway, and none of that had happened because my stomach was just not cooperating.
Right. I didn't even know that could happen. So
I me either. It did.
Well, good to learn. And so, like you just said, there are things that you have to do before they discharge you anyway. And a couple of them are they want you to be able to move around, right?
Mm-hmm.
And they also want you to be able to urinate, things with bowel movements, stuff like that. Can you describe more of what they were checking for and what you had to do in order to leave?
Yeah, well, all of those things. They wanted me to walk. So every morning, I walked like 2 or 3 times a day. I would get up, pole in hand, and walk down the hall and back, and they want to make sure I was steady on my feet. I was able to go to the bathroom. They want you to be able to go to the bathroom. Well, I didn't have to worry about urinating because I had the catheter in, but at least want you to pass gas, if nothing else, before you go home. So, all those things had to happen.
Right. And I know all told you were there for, you said like 4 to 5 days in the hospital, maybe discharged on the 5th day. Any guidance for people on how to, it doesn't sound like a long time, but in the hospital it can feel like a long time. So any tips on how to pass the time or?
I watched TV, I read, I visited, people came in to visit with me. I had quite a bit of company. But yeah, I mean, I did the things you normally do in the hospital. I did a lot of walking up and down the hall, just walking, making sure I had, because they told me they wanted me to not go home and sit, that I should try to walk as much as possible, as much as I felt up to it, as long as I wasn't in pain or anything. Right. And so I had already had it in my mind that I was going to do as much walking as I possibly could.
Yeah, I know sometimes for people too, it's like you're so tired or you're still recovering and you really have to push yourself to move. It sounds like you were determined and you were able to do that.
Absolutely.
Yeah, and at home it says you were recovering at home for 3 weeks, half of which that time you had a catheter in. Can you describe just sort of the whole recovery process at home?
Actually, at home wasn't so bad. My family was there. I had quite a few steps in my house at the time, the house I was in at the time. And so once I got upstairs to the second level of the house in the bedroom, the bathroom area, I could kind of negotiate my way around there. I didn't do a whole lot, but I would get up every morning, I would shower and get dressed. I had bought several pairs of scrubs,
Mm.
hospital scrubs, in a couple different colors. And so I could, because I wanted to be able to be comfortable, but also be able to go outside and walk around. And
Mm.
so I bought the scrubs for that reason. And so I would take a walk sometimes 2 or 3 times a day around the block initially. When I got tired, we would go back in the house. I would wait later and we'd go back out again.
Mm.
And so each day I walked a little further. First, it was just around the block. Well, first it was just up and down, up the sidewalk and back. And then it got to be around the block. And then I took 2 blocks around, and then I went 3 blocks around.
Wow.
But that was about it. But then the other thing, I started having bladder spasms. And that's not something that the doctor tells you about.
Ooh, what are
Um,
bladder spasms? That doesn't sound fun.
but because you have this catheter in your bladder, basically, your your bladder it's just like having a back spasm.
Mm.
And so this pain started coming, started to hit me. And even though I had pain medication, I really wasn't taking it because I really wasn't in pain. I was just really uncomfortable.
Mm.
But then when the pain did start, it got so out of hand, I couldn't handle, I couldn't negotiate the pain anymore. So I wound up going back to the emergency room like that following week on a Sunday after having been up for a whole 24 hours in pain. And that's what it was. It were bladder spasms. And gave me some medicine to stop the spasms. And the doctor, they got in touch with my surgeon. He didn't let them take the catheter out, which I was praying that he would, but he didn't. He wanted to stay in for a couple more days. And once I got that under control, they told me to take the medicine every 4 hours, just so that it would keep the pain levels down. But
Okay.
that was the only real issue.
So the bladder spasms were because of the catheter just being there, and it just, yeah, it irritated. Actually, the catheter is another thing that I think a lot of people are, just nervous about post-surgery, because I know you have to keep it clean. And then, can you describe maintenance of the catheter, and was it uncomfortable?
I'm not gonna say it was comfortable.
Right.
it was somewhat uncomfortable because it's you know it you gotta walk around with it. You gotta move around with it, and you have to sit down with it. You have to lay down with it. So you have to figure out a way to prop yourself up to be comfortable in the bed. And when you're sitting, you have to figure out a way to be comfortable and moving around. You can't, because you don't want to pull it out or you don't want to irritate it. So, learning how to live with a catheter was an interesting process. Cleaning wasn't a process. It wasn't bad because they tell you how to unhook it and cap it off, and you can shower just like anything else. But then you have to rehook it up and you have to get dressed again, and so that was a little annoying.
Sure.
Uh, Otherwise, it was fine.
Okay, well that's good. And what are they waiting for before they let you take it back and they remove it from you?
My guess is it's the healing process, and because you are losing your prostate, they want to make sure that you aren't losing a lot of blood, and that everything is flowing, and that your your fluids are coming out properly, and there's no issues there.
Right. Okay, that makes sense. And
Mhm.
so you've described all of that. It sounds like the recovery wasn't too bad. I mean, the bladder spasms were the worst of it, and you got them taken care of with the
Mhm.
pain medication. Following the surgery, when did you learn more about the cancer that you had, and what your plan would be? Can you recall the conversation with your surgeon?
Actually, yeah, he my follow up. Well, I went in to have the catheter removed, and I met with the surgeon also. Uh, and he came in and said that they had the removal of the prostate had gotten rid of all of the cancer, that it had not spread to any of the surrounding areas, and that all of my margins were clear.
Yeah.
He was not recommending me to see an oncologist or to go to any kind of radiation or chemotherapy.
Mm.
He had conferred with his colleagues, And, that's what they came back with. He told me to come back I guess I had to come back in 6 weeks because they did another MRI and I had another PSA test. He said that if my PSA, he said, well, the goal is that you will have a 0 PSA at that point, once they remove your prostate.
Okay, so we're back. We had a minor glitch there, but Clarence, you were just talking about how because your prostate was gone now, they were hoping the PSA level would be 0.
Correct. And I went back and I had the test, and it was 001. And from then I went back every 3 months for the first year. Same thing. I had the MRI, had the PSA test, doctor read the test, he read the MRI, everything was good. Following the year, it was come back every 6 months. And I did it for like 3 years, I want to say. And then it was, every 5 years.
Oh, wow. So you skip from every year to every 5 years after that.
Right.
Wow, that's okay. Well, that's great. That means that things are going well. Let's rewind a little bit. When the surgeon and you met the day you went back to the hospital to get your catheter taken out, and he relays this news, margins are clear, doesn't look like it's spread, you're good to go essentially. What was your, sort of reaction? How did you process that?
I was relieved because I really did not want to have to do radiation or chemo. That was a big thing for me. But I was really relieved that it did work and that I could be fine, live pretty much a normal life. There's some things about post-prostate surgery that you learn to live with. They also teach you, they sent me to physical therapy for, I think I went for like 3 or 4 sessions. But they teach you how to live. This is your new normal.
Can you describe what that new normal is for people? And I think people get really nervous, but when they hear someone actually talk about it, it might take away that mystery and take away some of that apprehension.
Okay, so here's the short version of what the new normal is. They teach you how to do Kegel exercises so that you could, strengthen your bladder. And I've had friends that have had the same surgery after me, and I have stressed to them how important that is. They talked about the fact that you're going to have the sense of urgency to go to the bathroom. You can't wait, go. Don't try to wait it out, or you may find yourself wet. They talk about, or you learn that if you're in the kitchen and water is running, suddenly you might have to go to the bathroom. Don't wait, listen to your body, go.
Right.
So you learn all of those things. You learn when you go out that you have to really be mindful of where you are and how you're doing things, because if you don't, it could be a problem for you. You learn that if you're driving, that you go to the bathroom before you leave the house. You know where the bathrooms are wherever you're going. You watch your water intake. You watch what you're drinking. All of those things. So it's just a whole way of programming yourself, because you know that you had this condition or the lack thereof.
Right.
It's just a different normal.
Yeah, no, I appreciate you talking about all that, because these are things that people are looking for. They want to hear it from an actual person who's lived it, and so it's about setting those expectations, learning about what this means, and then being prepared, it sounds like. My last question for this section is, I know you had follow-up. Now it's every 5 years, which is much better than every 3 months. But when you were dealing with that follow-up, was it hard for you mentally? Some people talk about It's called scanxiety. You know, every time you're having to go in for a scan, even if you're confident, people sometimes are really nervous because you have to wait for the results. I mean, just how were you able to manage constantly checking to make sure that you were still okay?
That didn't really bother me. And I guess because I wasn't sick before this happened,
Right.
there were no symptoms or anything. So me going to the doctor was just a regular thing. And
Mm.
like now, I haven't seen my surgeon for the last couple of years, but because I have a general practitioner that I see, and because he's the one that initiated this whole thing, you know, he kind of stays on top of it. You know, when I was there like a month ago, and he said, "Well, I'm gonna take your PSA test just to make sure that everything's still good."
Right.
Okay, no problem. And that's kind of how I process it. As long as there's nothing else happening, I think the only apprehension that you do have is if you have a sudden pain or something that's bothering you, your first thought is, I hope that this isn't, that the cancer hasn't went somewhere else,
Right.
or it's not another part of your body now, and this is the result of that happening.
Right. Yep. What you're talking about, people talk about under the topic of survivorship and sort of a new normal, if you will, or a different normal. I definitely felt it every time there was a pain anywhere. I'm like, uh-oh.
Right.
You can't help but go there, especially I think at
Exactly.
the beginning.
Yeah.
Okay, well, wonderful. Thank you, Clarence. We're going to move to
Sure.
the last section. So if you're interested, Clarence is going to share his reflections on the entire experience, and we're going to cover some pretty important topics. So I'm really looking forward to it. So hold tight.
Okay.